Senior Clinical Lecturer at the University of Exeter. Dr. Pankhania, thank you for your time this morning. And I guess one of the key factors in that decision-making of a lifting of any restriction will, of course, come from the SAGE committee that we've heard so much about in the last few days. A concern of yours is the makeup of that committee, not necessarily just the potential political people sitting on it, but a lack of expertise. Is that right?
Yes, and thank you for the opportunity. So we find that what the revelations in the Guardian newspaper indicate is that whilst the SAGE is made up of eminent scientists, it lacks the broad spectrum of jobbing outbreak control experts, people who do outbreaks day in, day out, people like myself, my colleagues, who are experts in communicable disease control, contact tracing, testing, all those things at the ground level. So the point is, you may have a group of eminent scientists, but you will all invariably be an expert in your domain. And what is needed is public health experts, a broader domain, people who also work at the grassroots level, so that we can contribute and advise and take part and make things better, to be honest.
Who decides who sits on SAGE?
It's a decision made by the chief scientific officer, and invariably the chief medical officer will have an input in it too. So it's at the top table that these decisions are made as to who joins in. People can come and leave SAGE. It's not like they're always sitting on SAGE with their domain, but we don't see the presence of these infectious disease control types at this table. And
so
I feel
therefore, if the CMO and sorry to interrupt, if the CMO and the CSA are deciding who's sitting on this committee, you think it's a failure of their leadership to have the necessary expertise around them, or do you think that they maybe are seeking that expertise but outside the committee?
They may be seeking that advice and information outside that committee, but it is always better to actually be within the committee, because then it is actually recorded, minuted, and we know what the input was and what the direction of travel was, rather than, oh, we will have a consultation with, for example, Public Health England on matters communicable disease control. Invariably better to sit at the top table.
In your opinion, with what's being talked about mainly in the papers, the Labour leader and indeed millionaire and billionaire owners of the Tory party seem to be leading this public call for a lifting of restrictions. If you were sitting on that committee with your expertise that you would bring to the table, do you think we're anywhere near enough being able to provide restrictions being lifted in terms of our capacity to test?
No, the shortest possible answer is no. A big flat bold letters no. And really we need to be very, very careful and honest with our people, which is lifting the shutdown when we are not prepared equals more cases generated. And if we have not got our homework in place, which is built up that capacity for lack of PPE, the capacity for hospitals to treat extra cases, and the testing capacity and the contact tracing, then we are lifting it prematurely. So this lifting has to be done very carefully and in a measured way. And I don't think we are absolutely ready yet to start doing it, because otherwise we will only be going back into shutdown, which we don't want to do.
Is it right, though, that there will be those voices around the SAGE table and in the public domain, you know, arguing against what you're saying by taking wider economic considerations and public health considerations into account with that decision?
Yeah, indeed, and I respect those thoughts very much. But I am also aware that when you have a large number of people in the United Kingdom dead and large number of cases compared to comparable European countries like Germany, we are not doing that well. Therefore, our first initiative has to be to protect lives, because we will address the economies. We need to rebalance the taxation structure and lift the people who've been put into poverty. But lives matter, and we need to, as an urgent matter, save lives in the first instance.
Dr. Bharat Pankhania, always good to speak to you. Thank you for taking the time this morning.